Imagine waking up one morning with a cough. It's mild, so you decide to wait it out. Days pass, the cough gets worse, and suddenly you're dealing with a fever, shortness of breath, or a complication you didn't expect. That simple choice to wait instead of seeing a doctor can be the difference between a quick recovery and a long, difficult illness. Why do we need to go to the doctor? It's a question both practical and profound, and the answer reveals how medicine quietly keeps our lives running. At its core, going to the doctor is about knowledge. Our bodies are complex systems, and symptoms are often clues rather than clear-cut answers. A headache might be stress, dehydration, or something more serious. A skin rash could be an allergic reaction or a sign of an underlying condition. Doctors are trained to interpret those clues. They pair symptoms with medical history, physical exams, and tests to figure out what is really happening. That expertise narrows down possibilities and points to the right next steps. Without that guidance, we guess, and guessing can be costly. Prevention is another big reason. Many visits to the doctor aren't about fixing a problem already underway, but preventing one from starting. Vaccinations protect us from dangerous diseases before exposure. Routine screenings like blood pressure checks, cholesterol tests, mammograms, and colonoscopies catch silent problems early, when treatment is simpler and outcomes are better. Early detection often means less invasive treatments and a higher chance of full recovery. In other words, regular checkups are like maintenance for a machine. Small adjustments now prevent big breakdowns later. Doctors also manage chronic conditions that don't go away on their own. Conditions like diabetes, asthma, heart disease, and arthritis require ongoing care. These illnesses need monitoring, medication adjustments, and lifestyle advice. A single emergency visit won't replace the steady supervision that prevents complications. Regular appointments help people stay stable and avoid emergencies. For many, that consistency is the difference between living a full life and being constantly reactive to setbacks. Trust in medical judgment also matters in critical moments. When a child has a high fever or an adult experiences severe chest pain, timelines matter. Doctors know which symptoms signal immediate danger, what tests to order first, and how to prioritize care. They can provide treatments that require expertise and equipment unavailable at home. In emergencies, that training saves lives. There is also a psychological dimension. Health concerns often carry anxiety. Seeing a doctor can alleviate fear by offering explanations and clear plans. Even when a condition requires difficult choices, a doctor's guidance helps patients make informed decisions. The relationship built over time, one where a patient feels heard and understood, improves adherence to treatments, and encourages honest conversations about lifestyle, mental health, and personal goals. Accessibility and early intervention are not perfect everywhere. Health systems, insurance, and social factors can create barriers. Nonetheless, the principle remains. Timely medical care increases the chances of better outcomes. Many modern treatments, from antibiotics to surgical techniques, have transformed once deadly conditions into manageable ones. Those advances are effective only when people seek care. Finally, going to the doctor is an act of responsibility to oneself and to others. Staying healthy reduces the chance of transmitting contagious diseases. Managing chronic illnesses reduces the burden on families and healthcare systems. Seeking care early can lower long-term costs and improve quality of life. So why do we need to go to the doctor? Because doctors translate complex signs into clear actions, prevent problems before they grow, manage chronic issues with steady care, and respond decisively in emergencies. They ease our anxieties and help us make choices that preserve health and dignity. In short, visiting the doctor is not just about reacting to illness. It is an investment in safety, longevity, and the ongoing story of our lives. When we choose to go, we choose knowledge over guesswork, and that choice matters.